I'm chairing this session, and we begin by acknowledging the traditional owners and custodians of the lands on which we live and work. And my sincere hope is that the knowledge that we generate through our research will allow learnings and understandings to develop across cultures. And my sincere hope as a teacher and a researcher is that my work and our work makes it possible for Indigenous people to live healthy, safe and rewarding lives. So this is a panel session focused on our project, Putting Death in Its Place. If you're at the session, at the conference this time last year, we also gave a panel session. And at that point, our application for a linkage grant had gone in. We were waiting for referee reports. And I'm very pleased to report that subsequently we've been successful. So are now beginning a 3-year program of funding to look at the issues that we'll be talking about today. So we don't have Chris Inwood with us, but we've got all the other members of the team. So could people just give a wave? We've got Richard Tuffin, Hamish Maxwell-Stewart, Martin Shanahan, John Wilson, Rebecca Kippen, and yep, that's it. Chris may join us. So we're presenting 3 papers in this session. We're going to begin with Richard, who will introduce the project. Then we'll have a paper from Hamish and John, and then finally a paper from Rebecca. So each presenter will speak for about 20 minutes, and then that will give us around half an hour at the end of the session for discussion. So Richard, if you're ready to go, you can begin.
Okay, all right, hopefully I'm not muted and you can all see the slide screen.
Oh, good.
So yeah, thanks for the intro, Lionel. I'm Richard Tuffin from University of New England, and I'm part of a pretty big project, all these people involved, including a few others who I appear to have forgotten. Now, I'm going to be introducing aspects of the project which are revolving around the digitisation and spatiality of the project, which is a really, really important part of putting death in its place. Yeah, it's a recently awarded project involving all these luminaries that you see, and it's underpinned by a relatively simple aim of linking historic demographic records to place and space in early or 19th and early 20th century Tasmania. And that is examining the relationships between where people live, mortality, life expectancy and health. And in the following 3 presentations, we're going to be looking at the extensive aims of the project, as well as some of the work which we've already commenced. So I'd say it's an accepted fact that where people live and work has an impact upon life course outcomes. And here's just some papers I found just to show that I can read and did some work. And as part of that, there's been a recent 2020 review into environmental determinants of population health in urban settings. And they identified 5 such determinants. So you've got the built and the natural environment, you've got access to healthcare, socioeconomic standing, and the behaviour of the individual. And these determinants can then be broken down into a series of specific sub-determinants as well. So this summary here from 2020 is as applicable to past lives and environments as it is today. Now, some of these determinants are quite difficult to reconstruct, particularly health behaviours. What information we have for this is likely to be highly qualitative and not systematically collected. But despite this, we can apply elements of this table that you can see here to our study of Tasmanian life courses. And this paper I'm going to talk about is going to briefly demonstrate utilising GIS, which is Geographic Information System, based mapping techniques to recreate and repopulate elements of these determinants, and particularly the built environment and the natural environment. And then with these elements partly reconstructed, we then have a means to examine determinants such as socioeconomic and healthcare. And that will be done using data matching techniques, allowing us to relocate past peoples in place and ask what impacts, both immediate and intergenerational, these places have upon life course outcomes. So in Tassie, we're really lucky to have a wealth of data to recreate the past environment, drawing from the holdings of the Tasmanian Archives, as well as Land Titles Tasmania. And these organisations hold thousands of maps and plans which document Tasmania's post-1803 development. These, of course, have all been completed at different scales, accuracy, levels of detail. And these representations provide an immediate way of interrogating how these past environments may have looked, how they developed, and how people interacted with them. So there's some examples of some sources at different scales there. Now there's two main ways we're using this type of spatial data. The first uses mapping derived data to visualize and analyze the historic built environment. So this is an example of a map of early Hobart that I'll talk about a bit more later. And the second turns mapping derived data into containers, if you will, for information. So the polygons, the points, the lines representing our historic environment, they all become geospatial hooks from which all manner of spatially inert data can then be hung. And this example here is from an earlier project looking at the Port Arthur Penal Station, and all those red outlines there are buildings that were active in the 1840s, and then you've got lots of metadata that we can start to add to those structures to help us understand them and the environment and then the people that were there as well. So looking at this mapping as information containers, we've got numerous scales at which we can work. So at the smallest scale relevant to us, we have all of Tasmania, and all of our data is going into that particular container there. Then we can sort of move on up in scale, and we can start linking information to administrative areas, such as this work here, which you see was mapping census boundaries in Tasmania. And you can see it's creating all these littler containers that we can start to put a lot of our data into. Scaling up again, we can look at the bounds of townships, within which are streets to which we can append data. So here is an example of Hobart. We have the original town boundary from the 1850s. We can put stuff into that. And then even smaller than that, we can have the early street grid, and we can begin to append data to those particular streets there. And then we get into the large scale stuff. And I'll be talking a lot about this in a sec. And this is where we can map individual building structures and even spaces. So yeah, that's fascinating stuff there. So that's sort of the spatial sources. The types of data we'll be linking to these spatial data sets encompasses a wide variety of sources, and they're going to be talked more about in the later papers. This is just an example of some of the stuff we have access to. So this is from previous projects. We have lots of information on births, deaths, marriages, height records, census data, and even weather data. And really importantly for our project, and it's an ongoing project at the moment, to transcribe and digitize valuation data. So showing about ownership, who was renting it, the value of the land, and also the addresses, most importantly. And this was compiled for Hobart from 1847 and for the rest of the colony in 1853. We've also got other forms of quantitative data, and this includes statistics and records collated by the Central Board of Health and the Metropolitan Drainage Board. And I'm as excited about parliamentary reports like this as Andre was yesterday about his parliamentary reports. As I will talk about, these sources provide vital for reconstructing the environmental factors which impact upon morbidity and mortality in 19th century Hobart, and to a lesser extent, Launceston as well. So they're the sources. Now, even though it's a very new project, we have already commenced work on creating both the small and large scale mapping, which will provide the foundation for all of this data linkage that we're talking about. So as already shown, progress has been made with creating accurate and time-sensitive maps of Tasmania's census boundaries. And these have created those smaller scale containers for linking data to understand coarser scale demographic dynamics. And yet at the other end of the scale, we've made good progress on mapping Tasmania's main population centre, Hobart. So that's our concentration for the moment. And we have two amazing data sources which span the 19th and the 20th century for these. So the first of these is a survey completed between 1841 and 1846 by surveyor James Sprent. Now, this captured Hobart at a crucial time in its development, just when it had expanded away from the coast and was starting to reach out into the hilly hinterland. And yeah, by this time the street grid had been set, and it's still the street grid today, and the inner blocks were being infilled with residential and commercial development. And here you can see on the left a composite of Sprent's map plans, and then on the right is one of his map plans there. And you can see the highly, highly detailed nature of this stuff from the 1840s, which is just amazing. By this time, you have large public buildings being established. This is Parliament House, which began its life as the Customs House. And you have areas of dense residential occupation, like this Wapping district was historically known as sort of the slum district of Hobart. And really importantly for us, Sprent completed his survey with a very high degree of accuracy, which allows confident georeferencing to the modern city. And georeferencing is basically when we can take his map and then put it over modern mapping to understand where real world coordinates are. And Sprent's map, as you can see on the left, fits very nicely to the modern city. Now, there's even more confidence in the next set of maps, and these are fantastic maps. These were completed between 1897 and 1907, so 50, 60 years later. And these were commissioned and collated by the Metropolitan Drainage Board of Hobart. And this was in response to a series of devastating typhoid epidemics which gripped the town, with the finger of blame being pointed at the poor state of drainage and sanitation. And just on the left there, you can see the extent of those plan sheets, and that is an individual plan sheet there on the right. So that's those 90 plan sheets which have all been geo-referenced to Hobart. So from the mid-1880s, you've got advocates pushing for drainage scheme to eradicate cesspits within the town's limits, introduce more sanitary measures such as pan-served toilets and drained water closets, and clean out Hobart's main rivulets. On the left there, you've got the plan which started it all by Alfred Moult in 1886, and that was his big proposal for the drainage. And then 10 years later, you've got an example of one of the drainage plans that's actually implementing all these sanitation measures in the city. So a really beneficial thing, which for us, as the result of this sanitation movement, was the production of incredibly detailed and accurate survey plans. So there's a zoomed in example of one there on the right. There's over 90 map sheets produced for Hobart and the immediate surrounds, and they capture everything from the structures to key drainage lines, water closets, pan privies, the location of the rivulets, water outlets, and each street as well has level data, which allows us to recreate the historic topography of Hobart. So it's very easy to see with these two highly detailed representations of Hobart, we're in a good position to not only reconstruct the built environment, but also to demonstrate how it alters over time. The high resolution nature of this data also provides a perfect platform for linking more detailed data sets. But to accomplish this, we have to convert these inert georeference maps I've been showing you to allow us to link and containerize all that non-spatial data. And we achieve this through the digitization process. So here's that Sprent map you saw before. And this is with all of his structures there digitized. So they are all individual containers. So you've got red for masonry, gray for timber. I haven't done any of the allotments or anything like that. We're just interested in the structures at the moment to make them as containers that we can link to. And the really important thing with this is these are all relative to the real world. So they're relative to each other and they're relative to anything else that we'll be mapping in these spaces. And we can just draw some simple early conclusions from that type of data, so we can see how dense the residential development is. We can see how many structures they are and what the composition of the town is at this particular point in time. So the timing of Sprent's survey is incredibly serendipitous because in 1847, the first valuations were completed for Hobart. And this has already been demonstrated by R.J. Solomon in his 1976 work on the urbanisation of Hobart, which is one of my Bibles for this type of thing. He showed that Sprent's survey can be linked to the data on ownership, occupancy, and the assessed value contained in those valuation assessment rolls. We can examine, or he did, and we can examine the distribution of assessed capital wealth and the occupancy and ownership of buildings, as well as provide insight into the residential quality and the form and function of these properties. And this helps lead to an understanding of the functional composition of Hobart's urban structure. And for us, with our access to these other data sets I was talking about, we can begin to bring in lots more spatial data or non-spatial data than Solomon was able to do. So we've got that census, births, deaths, marriages, which can all be linked to these spatial records I've shown you before. And so combine this with the type of analysis conducted by Solomon into the basic spatiality of Hobart's demographic and urban profile, it's getting pretty clear we can draw some interesting conclusions about some of Hobart's key environmental determinants. The challenge, as well as the rewards resulting from this form of linkage, is going to be talked about by Chris, Hamish and John in the next paper. So the plans commissioned by the Metropolitan Drainage Board provide an opportunity to accurately reconstruct Hobart's built environment, even more so than Sprent's 1840s plans. So these are more complex than Sprent's plans, so they're taking a longer time to digitize. You can see the extent of the map sheets there, which have been geo-referenced, and the darker areas are what I have digitized. So about halfway through after a good couple of months of work. So yeah, it's a slow process, but incredibly rewarding. And for a bit of fun, we can put in Sprent's digitization or digitized survey over the top of that, and we can immediately see how the intervening 60 years are really infilling Hobart's city blocks. So here's one of the MDB plans in more detail, and this reinforces the huge amount of wealth of information contained within these MDB plans. So as with the Sprent, all of these structures are digitized. So all those brown areas are individual structures which have been digitized in GIS, and we've got the rivulet running through there. And we can also, as well as these structures, extract some very useful information which isn't included in Sprent's plans. So we have toilets, which, you know, very unglamorous, but very important from the point of view of health, because although cesspits ceased use in 1887, toilets were still relatively primitive water closets and pan toilets, and the latter required a lot of collection and cleaning, and that wasn't always done. And so they do serve for vectors for disease, and so it's very important to sort of map those. So as you bring in all this other data, it just adds this extra layer of trying to understand morbidity and mortality in Hobart. We have another key piece of spatial information which we can extract, and that is the address metadata. So just to zoom in on one particular area, you can see we've got all the address information. We have the building number, street name. We have some buildings being named for their what they are and function as well. So there's a lot of information we can extract from those. And we do that by introducing coded data points for each address. So we have the street name, number, structure type and function, all of that being chucked into those data points there. And they provide the strong form of linkage for bringing in the non-spatial data that I've talked about before. Now, the MDB plans also come hard-coded with environmental information, and that's not at first obvious. But what we do have is huge amount of height data. So the surveyors went to great pains to gather height data across the Hobart grid, knowing this would be essential for drainage works that would follow. So you can see the vast amount just in that city block there of height information. So what we can do with that is actually reconstruct the early topography of Hobart. And this is sort of following a methodology which is from this paper shown here on the right, which has done this with similar Metropolitan Drainage Board plans for the Melbourne Hoddle grid. So sort of following that type of methodology as well. So this is where I've got to so far, sort of just showing the Hobart catchment there. That green area is that topography there. So what we can do with this type of information is extract further environmental determinants in the examination of population health. So we can look at height above sea level, we can look at the slope position of buildings, we can look at their situation relative to industry or waste. So where are they in relation to rivulets, known toilets, that type of thing. We can also look at exposure to things like prevailing winds. And so then you can start to bring in all that weather data that I've talked about before. Another form of environmental information is the position of the rivulets themselves. So historically, these were recognised as very problematic, considered to be little better than open sewers because they collected the runoff of the residences as well as all the industrial activity that's taking place in the Hobart catchment. So through the linkage of the health data, we can begin to test historical assumptions about these rivulets. Did they form the vectors for negative health impacts, and what sort of patterns can we discern in relation to them? And I'll show you in just a sec some early patterns that we're starting to discern with those. And finally, in closing, we can also get some very simple results by georeferencing contemporary health data completed by the Central Board of Health as a response to those epidemics in the 1880s and 1890s I talked about. So far I've accessed a series of these spanning 1886 to 1901, and there are just a couple of those maps there showing those disease incidences being linked to Hobart. And because they're on a map, I can then map them. And so what you have here is an animation showing those diseases mapped over those 10 years, just a simple heat map. So yeah, so like the plans of Sprent and the MDB, these can be geo-referenced to Hobart. And though slightly smaller resolution or larger resolution, these health reports do allow us to link known incidences of typhoid, scarlet fever, diphtheria, as well as infant mortality to mapping layers. So it just becomes one more layer of data which can be used to understand the impact of certain environmental determinants on past lives. And you can sort of see where in this mapping, you've got some concentrations definitely of diseases occurring where those rivulets are. I only did this yesterday, so I haven't had a real chance to sort of get in and have a proper look at it. So in conclusion, though it's really early days of the project, we've already begun the process of identifying, digitizing the resources, which will prove key to reconstructing these past environments. This reconstruction is taking place at disparate scales, driven by the data type and the questions that we're going to be asking. Now, of course, it's impossible and arrogant to think that we can recreate completely the past environments, but what these sources do is help us build a basic framework for understanding. We can reconstruct where county, town, and structural boundaries were, as well as how they related to each other and other environmental elements. And when we thicken this data with that of data from non-spatial contexts, like the census, births, deaths, and marriages, we can begin to put people in these places and spaces, forming spatial, social, and economic linkages that at least in part demonstrate the lifeways of the historic populations. And in the next paper, we're going to examine the many challenges inherent in this act of data linkage. So thanks, everybody.
Thank you, Richard. Just awesome paper, unbelievable. Thank you. So let's move straight to Hamish and John.
Great. So hang on a second while I just get the paper up. There in a second. Here we go. Now, hopefully you can see that, and hopefully it just transitioned.
That worked.
Good. So to give a bit of background to flesh the project out a bit, really what's driving it is the demographic transition, something that we all know very well. The switch in the late 18th, early 19th century from a pre-industrial high equilibrium, where most societies were characterized by high birth and high death rates, to a fall in the death rate occurring around about 1830, followed by a lag by a decline in the birth rate, which drives increasing population levels. And then in the 20th century, a low equilibrium rate, and in the 21st century, sub-replacement fertility. Now, there are other transitions that are embedded within this, which are less well understood, particularly in an Australian context. And there are three of these that the project really wants to drill down into. So a transition from urban to a transition which meant that urban places ceased to be unhealthy in relation to rural places. So by the early 20th century, it was better in terms of life expectancy to be born in a town than in a rural area. The second is a transition in male-female outcomes. So in the 19th century, women had a shorter life expectancy than men. That reversed going into the 20th century, and we cannot explain that by things like deaths in childbirth. And the third, opening up of an increasing socioeconomic divide in health outcomes, so that the wealthy start to outlive the poor by an increasing number of years. In order to look at these, we wanted to use the data that Richard has introduced you to get baseline data for Australia and create a blueprint for future Australian research projects. So we really want to use some of the techniques that we're going to try out in Tasmania in other contexts in the future. We have 4 really important data sets. Now, some of these exist already. We have a complete run of marriages and births, largely due to Rebecca Kippen's previous work from 1838 to 1899. We have an existing run of 155,000 digitized death certificates from 1838 to around 1928. We have plans to extend these. I'll talk about that in a little bit. We also have about 170,000 valuation rolls, but we think that in the period 1847 to 1899, that there are somewhere in the region of 1.25 million of these. We're in the very fortunate position of actually having 2 grants to do this. So putting death in its place was funded in the last linkage round. Our Christmas Eve present was the news that a second grant, Intergenerational Transmission of Inequality, which shares a great deal of the personnel with the first, also got funded as a discovery. And we're going to use this to try and digitize a big gap in the 20th century death certificates. So I'm going to talk very quickly about how we're going to get the death certificates, because they're crucial. We need these in order to find out how long people born in 19th century Tasmania lived into the 20th century. So this is an image of a death certificate from 1899. In fact, we've already transcribed this death certificate. What we want to do is to use these images and their transcriptions to create training data. And you'll notice that there's a nice grid to this record. So what we can do is create machine learning algorithms where we can instruct the machine to expect in this column to see a cause of death followed by a medical attendant's name. It will know all of the diagnoses that it has encountered before. And so we're hopeful that we can drive a system of word pattern recognition. And one of the things that's really important about this is if we can get this to work, we'll be able to code at source. So we won't have to go through a second iteration coding whooping cough, which is commonly spelt in the 19th century without a W. It can be coded as part of the transcription or the automated transcription process. So what all of this will give us is 2 sets of variables to work with, a set of compositional variables, which are largely about individual traits, and I've got a list there, plus the kind of things that Richard was talking about, contextual or environmental variables. And a crucial part of this project will be the creation of an amenities index for Tasmania, which looks at things like housing density in a district, sanitation levels, mortality rates, typhoid deaths, and we will tie that to the GIS maps that Richard was just taking you through. What John and I are going to briefly talk about is record linkage, and a lot of this project will succeed or fail on the basis of record linkage. Record linkage is always problematic in that there will always be records that you can't link, and those records will not be random. They're usually very important traits like socioeconomic indicators, which differ across the different groups of people that you manage or don't manage to link. A particular concern, for example, is illegitimate births. So often you only have a mother's name on the birth certificate that makes them much, much more difficult to link to a valuation role. So a critical part of this process will be that link. Can we link births to valuations? Now, what's nice about this project is that we have total count data. So not all births, of course, are registered, but we do have every registered birth, and we have every valued property, although every valued property does not equal every residence, because many residences can be contained within one property, which will only have one occupier or owner named on the valuation roll. However, as we link from birth to valuation, three things become readily apparent. If we get a link to an owner occupier, we know that somebody owns that property. If we get a link to a tenant, we know that somebody's or family is renting. And if we don't, then at least we know that they're either a subtenant, they're a member of an extended family, they're homeless, or they're institutionalized. So unusually, in terms of a linkage project, we actually know something about the people that we can't link. And then when we move on and link to death records, we are going to get a significantly greater failure rate, because unlike the birth and valuation records, where we have people born in areas where the properties are valued on the same year, of course, with the death records, it's possible that many of the people in fact, it's certain that many of the people in our population will have moved during their life course outside of Tasmania. So there'll be a linkage failure rate because we can't link to people because they're very common names, or because they're migrants, or in a small number of cases because their deaths are unregistered. But all linkage processes are iterative. And one of the nice things about Tasmanian death certificates is they generally include the place of birth, which allows you to go back to the birth certificates. And we're actually hoping that we do have deaths for people that we can't find a birth certificate for, which if we're certain that the record linkage failure isn't driven by things like common names, should indicate that that individual is that individual's birth was not registered. So again, it tells us something. Now, our initial forays into this, that the sampling that we've done indicates that we'll match about 45% of births to a valuation in a rural area, and a slightly higher percentage, 55%, in an urban area, largely because most birth certificates for children born in Hobart and Launceston give a street, and that gives you a more granular linkage into the property valuation records. However, in practical terms, I think our record linkage rates are going to be much higher than this. And I'm just going to quickly go through a couple of examples to explain why that is the case. So we're going to start with a family from Hobart. So this is Thomas Donaldson, who gives his occupation intriguingly as cowkeeper, and Catherine Donaldson nee Cribben, who were resident in Argyle Street when their son, John Donaldson, was born. So there's the street given on the under the informant on the birth certificate. Here is the valuation roll for that year. And there we have Thomas Donaldson, resident in Argyle Street. And indeed, we can do things like start to mark up this record by putting in things like occupational classification codes. And as Richard indicated earlier, we can drop it nicely onto Sprent's map. There is that property. And indeed, we know that they were renting because E. Howard is listed as the owner. So we've already built a relationship between tenant and landlord. And we also know the value of every single property in that street. So we can put this particular family into the context of their street and their suburb and the town that they live in. Now, interestingly, this child does not live very long. It dies 3 years later of erysipelas, But again, we can link that death to that specific location. So much like Richard was talking about earlier. But there are a number of things that we can do to actually extend outwards. So as well as linking an individual birth to a property record and then to a death certificate, because our birth records are already linked to our marriage records, in our database, we have this wonderful related births button. You can press that and out come the brothers and sisters. In this case, there's one brother and one sister. And in fact, both of these children die in infancy too. And what we can do in this case is just plot their life courses against the daily temperature for Hobart. And indeed, in the case of Martha Donaldson, who died of whooping cough, we can plot all deaths for whooping cough in Hobart over this period. So you can see that she actually died at the start of a whooping cough outbreak. And indeed, we could plot individually where all of these cases of whooping cough deaths occurred within Hobart. We can also go backwards into the family context. We have a convict database, and intriguingly, both of these parents turn out to be convicts. The convict records are great because they give place of birth outside of Tasmania. And so Catherine was born in the Isle of Man and Thomas in Derry in Ulster in Ireland. And indeed, we can also work out why, if we wanted to, George Westbury turns up as a witness on their marriage certificate. It's because both him and Thomas Donaldson were appointed on the same day as special constables in the penitentiary barracks in Hobart. So we can build quite a lot about the social context that links whole neighborhoods together. Finally, we can actually put into context the little mini disaster of having 3 children who all died in quick succession in Argyle Street into the larger life course of Catherine and Thomas. So after renting the house in Argyle Street from 1850 to 57, they moved in 1858 to the outskirts of Hobart into a cottage and garden, which again they rented, but had 5 times the annual value of the property in Argyle Street. In 64 or 65, they moved to a house nearby, but it turns out that this was a strategy because they had purchased land in a neighboring street, Wellington Street, and they built a house there, which in later records, they're recorded as being the owner-occupiers. So here we have a story of social mobility. And indeed, we have 2 death certificates, which we can link to both of these individuals. And you can see that on Thomas's death certificate, it says born in Ireland and died in Wellington Street. So a nice tie into the valuation records. And although Catherine died in the General Hospital, which again tells us something, it's got born Isle of Man on her death certificate. Intriguingly, both of them die of tuberculosis, and Thomas's occupation is given as milkman. And so I think it's rather interesting that through this process that we're going to be able to reconstruct individual trades, but we can look at occupations like that are related to things like the supply of milk in urban areas and put that into the context of mortality. Finally, I'm going to just quickly run through a member of the rural poor. So this is the birth certificate for William Horn, who was born to George Horn and Sarah Horn nee Manser in Bothwell in 1882. Now, when we try and link this to the Bothwell valuation record, we get a fail. Perhaps this is not particularly surprising, since William's father, George, was a shepherd. And the place of residence on the for George at the time of the birth is given as Trap Hut, Blue Hills. But perhaps surprisingly, we can find out where Trap Hut is. And indeed, we can give you a photograph of it because it recently came up for sale. So linking to property databases turns out to be quite valuable. We can also press the magic sibling button and get the entire family. And indeed, we can work out where every brother and sister was born in this family. So what you've actually got here is a story of a shepherd who's moving between different pastoral properties. And towards later life, when he has an established family, he actually relocates to the small regional town of Bothwell. And so whereas we can't link him specifically to valuation records, what we can do is put him into context. And indeed, we have the birth order and the birth interval and the parental social and social mobility story and geographical mobility throughout their life course. So I'm going to stop at this point and hand over to John. So let me just quickly stop the share. John, over to you.
Unmute, John.
Sorry, I just got to stop the share. I was trying to share, but it's not picking up the screen with my. It's not picking up the screen with my thing on at all. Just bear with me. Share, please, please, please. There it is. Thank God. Okay. Sorry. Okay. So. Thanks, Hamish. I'm not adding too much to what Hamish has already talked about, but one thing I just wanted to play around with after we did these Bothwell valuation linkages to the 1885 births was to try and link some of those children born in 1885 and their siblings to World War I records. So as Hamish has already covered really well, we've got this set of birth records. In this case, we're looking at 1885. And we get parents' details in those birth records, which we can then match pretty easily at a rate of about 45% to the valuation records. So we get an owner, a tenant, it's usually a tenant, right? And we can get a value of that property. What I wanted to play around a little bit doing was records and just try and automate a name match between AIF in this to put their place of birth as Bothwell and these birth records. And then also using, I'm not interested in anyone that I can't directly link to a family of these people born in 1885, just as an experiment. So I'm interested in related children. So I can link into the marriage records as well to find related children, i.e. their siblings. Why is that really interesting? Well, for a couple of reasons. One is the AIF records give us a lot of information about where people are during and after the war. And of course, we get the biometric information as well. Sorry, I just haven't got this playing. So there we go. So of a little sample, well, we've got all the investees of World War I, so 15,187 records. And 142 of those enlistees listing the place of birth as Bothwell. In 1885, looking at those 56 people born, I get 30 surname matches from those births. Digging around a little bit, now that's just an automated process that I use, digging around for Bothwell and the surname match. Digging around a little bit, I couldn't identify clearly 6 of those as a family member, but that left me with 24. 4 of which I can see are those born in 1885, plus another 28 siblings. Okay, so we've got 32 enlistees that I can link back to those records of the births. In what follows in these slides, I'm going to talk about some digitized stuff that's currently digitized, but also I did go a little bit further into the AIF records because I'm interested to see what other information is out there and what's possible for the future. So that's obviously a manual exercise at the moment, but you know, you get a lot of information about where soldiers lived at discharge, or where their next of kin lived at discharge or at death if the soldier died, and residents ongoing post-war. There's a lot of correspondence after the war between whether it's next of kin if the soldier died or the actual soldiers, concerning things like medals and disability pensions and the like. Medals are really interesting. Medals seem to be of great value. A lot of people lose medals and are looking for replacements because, and they have to give reasons, and they say because it helps them get employment, which is really, really interesting as well. We've also got the location of next of kin, which I don't think is digitalized the next of kin are, and there's been some linkages done. And as I say, we get this really excellent height data, which is digitized actually at the moment. But, you know, it's this biometric piece of information about people of whom we know where they were born. And so we can start to look at, you know, their outcomes when they're 1885 births or thereabouts. So, you know, in their mid-20s to 30, and look at their heights and the like. So really, really interesting. So some early results of these 32 people that I looked at, just looking at who they listed of next of kin, 23 of them listed their parents. And interestingly, of those 23 parents, we've got 16 who still live in Bothwell at the time their soldiers enlisting, so nearly 30 years later. None of those parents have moved outside Tasmania. So there's some, you know, very small number stuff here, but some evidence that the parents aren't moving around too much from their original town. There's also an uncle and a son in there listed as a next of kin, and they're both in Bothwell as well. For those who listed next of kin as a wife, none of them are living in Bothwell. So we've got 6 elsewhere in Tasmania, and sorry, it's my phone ringing. And why does the phone always ring when you're making a presentation? I've got to learn to turn the thing off. And 1 in Rockhampton. And the Rockhampton case is very interesting, but I won't talk about that now. Most are enlisting in Tasmania, and 29 of them are in Claremont, which is northern suburb of Hobart, and 3 interstate. I also I've started doing it, but there's not enough info to say anything sensible at the moment. But as Hamish pointed out, you know, to look at the occupations of these soldiers versus the occupations of their father is a really interesting thing to do as well. So as we get more data, that's going to be something that's going to show up, you know, that sort of social mobility that Hamish talked about a little bit. So an example, right, just to show you how the process works. Here's a girl who's born Annie Bailey in 1885. She actually passed, this is her copy of her birth extract, which I appreciate is very, very blurry. She actually passed away, so obviously she's not going to be in World War I, and she's a female, so very unlikely. Parents identified in that data are Thomas and Jane Bailey, and her maiden name is Burke. We also get an occupation for Dad, that he's a blacksmith. Place of birth, we can link back to those parents via the 1885 valuation. So we find out they're in Alexander Street in Bothwell. It's a house and shop. Him being a blacksmith, perhaps that makes some sense. A house and shop, it's 1 acre. It's owned by a chap called John White, and it has a value of £20. So we're getting some information about, as Hamish's previous examples, you know, the conditions upon which they're born into. My name matching from Bothwell and the surname gives me a match for a chap called Thomas Arthur Bailey, and using the marriage records and those related children, I can see that he is indeed a brother of this girl, and he's born in 1889, okay, so it's got the same parents, this is the birth extract here, same occupation, so we can see that. So this is one where he didn't list a parent as a next of kin. He's actually got a wife, but still very, very easy to find just through simple matching. Then we go to his attestation papers, and you'll see, and this is the information that's already digitized, place of birth. When I say you'll see it, I know it's really blurry and you might not be able to read it too well, but that does say Bothwell. We get his next of kin details. So Mrs. Ida Bailey, and that's his wife, as it's written up there. And she's living in New Norfolk, but we don't have an address. And we've also got his occupation, and it turns out he's a blacksmith as well. And actually there's a little note there underneath where it asks whether he's been an apprentice. He was an apprentice to his father, so he's learned the trade from his father. As I mentioned as well, in that record, this is where we get his biometric details. So he's 26 years of age. This is another little check because he's born in 1889. He's enlisting in 1915, so it's the right age. We get his height, we get his weight, so what, 60 kilos, 5'4", okay. and his chest measurement. And then sometimes you get some information about whether they've got scars or other medical issues as well in these records. Then we get, sorry, let's get this blocked out a bit. Then we get later information, and so all of that stuff that I've shown you so far is pretty much digitized. But then you get this really interesting information in the files. For example, here's a letter from his wife to the officer in charge of at one of the bases, because he's actually fallen ill, and she's trying to inquire as to his well-being. And we now get an address, Blair Street in New Norfolk. So we know where this chap is living. And then, sorry, there we go. And then for this guy, actually, it was kind of interesting because in 1964, he's still alive. And we get another address for him, which is Charles Street in New Norfolk. He's, this is from a solicitor who's trying to get information about his certificate of discharge. He's looking for a certificate of discharge. So even right down to 1964 here, we're getting information about this person. So kind of a bit like Hamish did, and I really need some tips from Richard in terms of my maps. You'll see in a minute, I've got this Google map and then a crappy old UBD map of Norfolk. We know that he's born, well, we know that he's born in Bothwell. I hazard a big guess, and when we get more data, we'll know this, that he's still in Alexander Street in 1889. At some point at or before 1915, when he enlists, he moves to New Norfolk, okay? And then we have two data points in New Norfolk. Oh, sorry. Two data points in New Norfolk. So we have Blair Street in 1918, and then in 1964, he's moved, or he's living in Charles Street. Now, where he is in between, I don't know for certain, but I think this is just an example of what Hamish was talking about, but the scope with some of the other data sets that are available to us as well, if we can increase and digitize more of those. But the AIF stuff's really interesting for a couple of reasons. One is, as I said, those height data. The other is the occupation data. So we're learning something about these children that were born in the 19th century and what their occupations are. We can get locations, and we get locations of next of kin, as I said. And if these soldiers die, terrible thing to sort of say, but it's a wealth of information, because then you get much more information about the next of kin, which is often parents, and where they live in the 1920s and 1930s until their death, because there's lots of correspondence between them and the army. I wanted to talk a little bit about matching issues, but Hamish covered it so well, I'm not going to say too much, but you know, just anecdotally in the stuff I was looking at, we are going to have issues and need to deal with them. So spelling discrepancies across time in names, Bumford versus Bomford, Westall versus Westall. You see these things quite a bit. The MUCs, the Macs, M apostrophe, O apostrophe, right? So McRae versus McRae and Murray is coming up all the time. And so this is something that we're going to obviously have to deal with. And it's obviously not random, right? Bothwell's quite a Scottish, a town with a bit of Scottish heritage. There's a few MUCs in amongst the crowd there. So something obviously we need to deal with. Just to show you that Bumford example, here's the children of Mary and William Bumford. And you can see it's BUM, 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 until we get down to Ellen Irene here. So there's John, born. The record shows it clearly BUM. Okay, there's the surname of the father, BUM. Here, for Ellen, it's clearly BOM. Okay, now whether that's because they've been misheard or what the reason for that is an interesting one, but it obviously poses a problem for us. Just as a little bit of extra there, Harold was one of the Bumfords. 3 of them served in World War I. On his attestation papers, it's entered as Bomford, and then the same hand has actually crossed out the O and put a U, so it's been corrected. But then he signs Bomford, B-O-M as his name, and 2 years later, there's another thing with his signature and it's B-U-M. So, you know, I don't know what was going on with these people, but obviously we're going to have to deal with these issues. Hamish also mentioned about where you've got a family and there's no listing, but there's clear evidence of siblings living in the area. We're going to have to make decisions, and it's that efficiency versus accuracy sort of trade-off. You know, do we assume they're living with their parents? That's a big call to make. If not, where are they? I like Hamish's comment that, you know, no information is information, so we're still getting something about them from that. The example of Trap Hut, which was found just, you know, trying to find out where the hell Trap Hut was, and there it was on realestate.com. But, you know, we've got to be careful that we're not excluding the rural poor, and trying to find out if we can at least find the location of where they're living, even if it's not valued, and then look at things like amenities indices for that. As a quick example of that, I looked at the infant mortality of Bothwell in the 1880s.
John, have 2 minutes, please.
Yeah, plenty. Yeah, this is the last slide. Yeah.
Okay.
Yeah, you've slowed me down. Infant mortality, Bothwell 7.8% in the 1880s versus Hobart 17%. Erasmus deaths of children less than 10, 310 in Hobart, Bothwell nil. So this is all giving us information, and we've obviously these are just 2 data points, but we need to get information about the conditions in these areas. There you go, done.
Okay, thanks, John. Thanks, Hamish. Rebecca, you're up next, please.
Just stop my share. Sorry, Rebecca. There you go.
That's okay. Can you see my slides?
Yes.
Great.
All good.
First, an apology. I'm part of the PLACE project, but this presentation is not. It's a reading. National borders locked down, blanket quarantine of repatriates, state borders shut, a rising number of infections and deaths, friction between federal and state governments, mask mandates, social distancing, public buildings shut, schools shut, the problem of unemployment. This was Spanish influenza, Australia, 1919. Throughout history, communities have introduced restrictions to contain epidemic diseases. Australia's early go-to policy after colonisation was to quarantine ships to keep out infection. This was first used in 1804 to prevent the introduction of yellow fever from New York. And for as long as there have been vaccines, there have been vaccine mandates. For example, in that great bastion of freedom and individualism, America, George Washington ordered in 1777 that all troops in the Revolutionary War against the British be inoculated against smallpox. In this little romp through Australian history, I will touch on smallpox, Spanish flu, Russian flu, bubonic plague, and polio in illustrating how epidemic restrictions, vaccine mandates, and unfortunately associated conspiracy theories and quack remedies are nothing new. First, to smallpox. Smallpox was a terrible disease. It killed about 20% of its victims, with a higher death toll for infants. Some survivors were left blind, and most had extensive scarring. Smallpox inoculation was in use in Asia and Africa from at least the 16th century. This involved transferring smallpox pus from an infected to a healthy individual. The healthy individual would hopefully develop a mild case and be protected from infection thereafter. From the mid-1700s, it was observed in England, France, and Germany that those who had been infected with cowpox, a mild disease, did not contract smallpox. In 1798, Edward Jenner, an English doctor, documented his successful experiments in vaccinating patients with cowpox material, proving that they were protected against smallpox, and thus the first smallpox vaccine, and indeed the first vaccine, was born. This procedure quickly spread through Europe and was reported in the Australian newspapers. In 1804, the principal surgeon of New South Wales, Thomas Jamieson, urged parents to avail themselves of the blessing of having their children vaccinated with cowpox, an infallible preventative of that loathsome, disgusting, and too often fatal disease, smallpox. In England, in 1853, vaccination of children against smallpox became compulsory. Some of the Australian colonies soon followed. In Victoria, the Compulsory Vaccination Act was passed in 1854. This required that all children aged 14 years and under be vaccinated within 4 months of the passing of the Act, and that babies be vaccinated within 3 months after birth. The government set up vaccination districts with the aim that no parent would have to travel more than 3 miles to have their child vaccinated. A certificate of vaccination was given to the parent and lodged with the local registrar of births, deaths, and marriages. The penalty for non-vaccination was 40 shillings, about a month's wages at the time, increasing if non-compliance continued. As noted by Rebecca McWhirter, Victoria both enacted and enforced compulsory vaccination. Tasmania passed but failed to consistently enforce similar legislation, and New South Wales never imposed compulsory vaccination. Victoria was the most willing to engage in interventionist policies, while New South Wales was keen to avoid mass interventionism while still trying to engage in preventive measures to protect public health. From 1913 to 1917, New South Wales suffered a major outbreak of smallpox, with Sydney at the epicentre. The nascent federal government used its new Commonwealth quarantine powers to quarantine Sydney from July 1913 to stop the spread of cases beyond state borders. Anyone leaving Sydney to travel to another state had to produce a vaccination certificate showing that they had been vaccinated within the past 5 years, an early vaccine passport. The Commonwealth also urged New South Wales to introduce compulsory vaccination, legislation that had been in place for decades in other states. The state government, business groups, and a large proportion of the general public bitterly opposed this federal intervention. There was a standoff. The New South Wales government refused to mandate vaccination, and the Commonwealth government refused to lift the ring of steel around Sydney. The Truth newspaper, a scandal and conspiracy-driven tabloid in circulation from the 1890s to the 1990s, had a field day. Over many months, it claimed the outbreak wasn't smallpox at all, that vaccination did not prevent smallpox, that vaccination was killing and maiming thousands, and that the smallpox conspiracy was driven by doctors in cahoots with the regular media, wanting to profit from charging for vaccination. Although vaccination was not mandated by the state government, more than 1/3 of Sydney-siders lined up for the jab in 1913. Some employers made vaccination compulsory for their workers. Many small businesses collapsed because of the restrictions on movement. More than 2,000 smallpox cases and their close contacts were forcibly taken to the North Head quarantine station until deemed no longer infectious, usually after 14 days. After almost 5 months, Sydney's quarantine was finally lifted in November 1913, although the epidemic simmered on for another 4 years. Hot on the heels of smallpox came Spanish influenza in 1919. Australia had managed to keep out the disease in 1918 by quarantining its national borders. However, it seems to have snuck in on a troop ship, repatriating shot soldiers in January 1919. Maritime quarantine was ramped up. The state shut their borders. Places of public gathering were closed. Schools were closed. masks and physical distancing were made compulsory, and unemployment became a major concern. Although hospitals were still overwhelmed, the restrictions did work to limit the spread and number of deaths from influenza in Australia. And these here are headlines from just one day in 1919, most of which could have come from the past 2 years in Australia with coronavirus. This is an isolation camp at the Albury Sports Ground where people had to stay for a week, then prove that they were symptom-free before they could cross the Victoria-New South Wales border. And here we've got early PPE worn by nurses. Then, as now, state border closures were particularly tough on border communities like Albury, Wodonga and Tweed, Coolangatta. Other striking restrictions to limit infection were introduced for bubonic plague in Sydney in 1900. Those infected and their contacts were compulsorily taken to the North Head quarantine station, some for several months, and their place of residence was disinfected. Gangs of men were employed by the state's newly formed plague department to carry out rat exterminations and house-to-house inspections and cleansing. Various areas of the city were locked down, with people not permitted to move in or out of those areas. Rations had to be trucked in. Wholesale demolition of buildings was undertaken to improve hygiene and to try and eliminate the plague. Polio scourged Australia from the 1930s to the 1950s. In the 1937 outbreak in Victoria, schools were closed, children were banned from using public transport and from crossing the border into New South Wales or South Australia. In a small proportion of cases, polio causes paralysis, which can prove fatal or result in lifelong complications such as skeletal deformities, muscle weakness, or the loss of the ability to breathe independently. For the last, patients were encased, sometimes for decades, in an iron lung, which breathed for them. Polio was eliminated within just 2 years in Australia, once the Salk vaccine was introduced in 1956. So back to vaccine mandates. It's kind of odd that anti-vaccine protesters last year rallied at the Melbourne Shrine of Remembrance and more recently in Canberra chanted repeatedly, "Lest we forget." Perhaps they were thinking that our serving men and women fought for freedom from vaccine mandates, whereas in fact there have been compulsory vaccinations of Australian service personnel off and on for more than 100 years. Enlistees for the Great War or the First World War were required to be vaccinated against smallpox. Any man not prepared to be vaccinated would not be enlisted. After enlistment, any man refusing the vaccine would be prosecuted. And here's a notice from the Second World War, when a bunch of inoculations were compulsory for the men of the Australian Imperial Force against smallpox, paratyphoid A and B, and tetanus. From the mid-20th century, most countries of the world required travellers to carry an international certificate of vaccination, the ubiquitous yellow card, proving that they've been vaccinated against smallpox, against smallpox and other diseases before being allowed entry. We now have a number of effective and safe vaccines against diseases that used to kill and maim a lot of people. These include vaccines for diphtheria, measles, mumps, whooping cough, polio, rubella, and now COVID-19. No longer smallpox, since this was eliminated globally in the 1970s by the World Health Organization through the most effective committee work ever using the smallpox vaccine. In the mid-1990s, only half of Australian children were being immunised. In 1997, the Immunise Australia plan was introduced to increase childhood vaccination rates. Part of the plan was what is now called No Jab, No Pay. To receive government-funded family payments, parents must provide evidence that their child has been immunised. Previously, religious or philosophical exemptions were permitted, but these were removed in 2015. A related policy, No Jab, No Play, was introduced by state parliaments, preventing unvaccinated children from attending childcare or kindergarten. Vaccination rates for Australian children have now increased from 50% to above 95% because of these vaccine mandates. So that's a quick summary of some epidemic restrictions and vaccine mandates in Australia over the past 2 centuries. I briefly mentioned the Truth newspaper's contention that the 1913 smallpox outbreak was a conspiracy cooked up by the mainstream media and the medical profession. To finish up, here are some other conspiracy theories around during previous epidemics and also quack remedies available for supposed prevention or cure. The last major pandemic of the 19th century was Russian influenza, which circled the globe from 1889 to 1891. In fact, Russian flu was probably a coronavirus rather than influenza. In 2005, Belgian virologists determined that a currently circulating coronavirus that causes the common cold probably jumped from cattle to humans around the year 1890, first as a severe disease, then mutating to its current mild form. In addition, recent analysis of historical records indicates that the symptoms of Russian flu were more similar to those of severe coronaviruses, such as COVID-19, rather than to influenza. Anyway, that's not the conspiracy. I just thought it was interesting. As we all know, in 2020, a conspiracy theory emerged that COVID-19 was being caused by 5G networks. Part of the supporting evidence was that the number of COVID cases was higher in areas with 5G towers. Of course, the common factor was population. More coronavirus cases in areas with more population and more 5G towers in areas with more population. A similar theory was propounded 130 years ago during the Russian flu pandemic around that newfangled innovation, electric lighting. The New York Herald noted, the disease has raised chiefly in towns where the electric light is in common use, and concluded that the lighting was causing the flu. This theory made its way to the Australian newspapers, but not, it seems, fortunately, to policy. During the Spanish flu pandemic, which began during the final year of the First World War, one theory was that flu was being spread from German submarines as a type of biological warfare. This was widely reported in the Australian press. Quote, "U-boats are probably responsible for the epidemic. The diabolical barbarism of Germany seems to know no limits." And in conclusion, in the past, as now, there was always someone out to make a buck with a quack remedy. Livertonia was a local liver tonic, mainly promoted in Victoria. In 1913, taking advantage of the Sydney smallpox epidemic, its promoter added, "Will prevent smallpox" to Livertonia's Sydney advertising. The tonic was not effective and neither was the advertising. The Livertonia Liver Cure Company went broke in 1916, and the judge presiding over the liquidation noted, quote, "The business which the applicant carried on was the mixing and preparation of a series of mysterious compounds, and by extensive advertising, he hoped to dispose of them to an incredulous public." More successful was aspirin, still in production today, although the claims here are no less wild. Aspirin can certainly work to reduce fever, but it is not an internal disinfectant and it does not prevent infection from influenza. However, it was certainly better than quinine, the ivermectin of its day, which was ineffective against flu, but nonetheless often prescribed by doctors or demanded by patients. I feel like I've been saying, no, totally precedented. For many months, anytime someone says that state border closures or other restrictions or vaccine mandates are unprecedented. I hope that this presentation has demonstrated that while the scale might be different, epidemic restrictions, vaccine mandates, and unfortunately related conspiracy theories and quack cures have been around for a long, long time. In conclusion, in line with the theme of the conference of data sources and digitisation, I'm immensely grateful to organisations that have digitised sources and made them available online, particularly the National Library of Australia for its wonderfully comprehensive and searchable collection of digitised Australian newspapers. Thank you.
Thanks, Rebecca, and thanks to all the presenters. We have some time available for questions. Please feel free to direct your questions to any of the presenters or to the project team in general. So who would like to start? Thank you, Deborah. Thanks for your kind words.
So
yes, Flora.
This might be trying to figure out if it might be Hamish and Richard. I'm trying to figure out kind of like whether you can identify kind of like neighbor, almost like infection type pathways. So if you have like certain diseases showing up, so you had like the maps of I think it was dysentery, it's like how kind of like, well, or not just kind of like with disease, but in general with kind of like neighbor effects. So can you see saying like you're living in a certain neighborhood, you know what the neighbors are in terms of like occupation or other social characteristics. Can you identify essentially like does the neighbors effectively will have an influence on later life outcomes? I think so I'm currently trying to get my head around kind of things. The one that came up is I've never seen a published version, but I've seen a presentation version where Joe Ferry did a paper on looking at like industry. I think it was like some American town, Omaha, and kind of identified like kids were growing up in this part of the town, which was influenced in the shadow of industrial kind of pollution. And then you have like people in area that live similar social environment, but not in the shadow of that or in the wind of that factory, and kind of looked at later outcomes and found better impact. And so I'm trying to things like can you identify something along the lines with environmental impact, but also with kind of social impact? So you're growing up in a region that basically has a lot of immigrants from this place, and other areas has a lot of immigrants from this place, even if they're not your cultural groups. Would that have an impact on later outcomes that you might be able to observe?
Do you want me to have a go at answering that?
Sorry, it's not particularly consistent. I'm just kind of like trying to get my head around kind of like the data and how you can kind of like use it.
I think it's a really, really interesting question, and it's got really, I think the answer has two parts to it, possibly three. So the first is that this drives right at the heart of these compositional and contextual effects. So it's socioeconomic characteristics within the individual and their family and perhaps their neighborhood, and the environmental effects. My feeling is that one way of teasing this out is to look at those downward and upward social mobility tracks that we were hinting at, so that you've got some families that go downwardly mobile into a particular area, others that move out of a particular area, and we can measure the impacts on life expectancy or height, where we've got things like First World War records, compared to people who remain static in particular areas. Now, the more complicated way of doing this is, do we create area attributes so that we have an amenities index for particular areas, which we get more and more granular. Or, and we're increasingly thinking about this, do we look at NoSQL databases so that we try and relate everything, every variable that we've got, every record to every other record, which is a much more complicated. It's like a mass of spaghetti when you do something like that. It's very difficult to get around it, but it allows researchers to structure the record sets in a way that would suit their question. Whereas if we set everything up as a series of amenity indexes and tables, you have to unpick our tables to answer a question that we haven't structured them for. I hope that makes sense. So yes, I think we'll be able to do all of those kind of things. It's probably going to take quite some time though. And my hope is that we are assembling the resources to allow questions like that to be answered, but it's not going to be straightforward. And I think as a community as a whole, we need to take a really hard look at the way projects like this are set up.
Yeah, and I'd just add, I think spatially it's variable. So like just talking from the Hobart perspective, you saw we've got these two amazing data sets, Sprint Maps 1840s and then Metropolitan Drainage Board plans. And they are these two fantastic ways of linking data to that. You've got quite a high certainty that what an address is in the valuation rolls will match at that particular year for the 1890s. But then as you move away from that, that certainty gets less and less and less. And we might be able to work that in to our data and say what our certainty is with that. But even with that disease map I showed you at the end of my presentation, we're seeing some interesting patterns just from mapping that type of stuff across 10 years of relatively coarse data of seeing, these diseases just moving around that city block. And what that relates to, it'll be interesting to bring in all that other data to see why is that happening. But you're not seeing concentrations just staying in a certain area. It's moving around as obviously more people are susceptible to it in different areas. I don't quite know. It's not my area of expertise. I just do maps. But
okay, cool.
we can map industry. We can map all those type of things. And as we introduce those, I think we can get quite a good idea about that aspect.
Cool.
Okay. Any other questions? Yes, Florian. Yeah.
Sorry, it's like Alison. One of the another thought. This I might have missed it somewhere in between, but like in terms of like obviously saying like this is like going back to Hamish's how basically flexible is set up. In terms of like in socioeconomic environments, obviously things like kind of like religious congregations, parishes might have registers or certain clubs. I mean, things like I'm part of the Rotary Club, but like that happens a little bit later, but like there might be other social clubs that might be forming at a time. So I assume you can basically almost like put that into your databases and saying like this is that at that point someone was essentially living, someone was belonging to that area at that club at that particular time. And then kind of like mapping it out almost like so you have whatever the Anglican parish in Hobart, I presume there's one. And then where are the people actually living? So are they actually kind of like living close by, or is this basically kind of like you're drawing actually people out? And then you might get to kind of like these kind of maps with disease, saying like you have certain diseases that might be biologically like natural environment driven, when you have like kind of like other patterns where like you go through contact, where then kind of like if you find that like whatever that disease pattern is the same as kind of like the congregation of that particular church, then that might kind of give you kind of like another link of like, okay, there's probably an indication that might be correlated in some form.
Look, absolutely. I mean, we see this project as being, an important part of it is creating an historical filing cabinet.
Yep.
So it's one of the reasons why we're working very closely with archivists. And indeed, one of the very exciting things that John and I have found sort of tunes in very closely to what you're saying. The links to Trove are amazing. So you have an itinerant shepherd, you're trying to find out where their children are born. And if you put them into Trove, you get wool sales from all of those properties.
Yeah.
So what we hope comes out of this project is a standardized set of ways of keeping data alive that allows other researchers to plug more data into it in a way which is useful for them. So, I'm hoping that we're able to leave all of these data sets on Nectar, so the Australian Research Data Commons platform, at the end of the project, where they'll be accessible and people will be able to build on them.
Alison, did you have a question?
Yes, I'm off mute, and thank you for that amazing session. And hello, everybody. Rebecca, what a wonderful journey through really important matters. And like you know, I used to think that the most boring things we could all say as historians was it's happened before, but all of a sudden with COVID, it turns out to be the most important thing that we can say and show. So I'm with you on that. I was really struck by many things in your great paper, but the lest we forget layers of irony, as you say, are extraordinary and really, really important. And I wondered, this is an expedient kind of question. I wonder what you're going to do with that, because I think that's a very important message that has kind of been noted before, but you've got all this substance and material behind it. And really it's a comment to encourage you to go forth with that set of information. And, one almost doesn't even need to overdo the ironies. They're so self-evident, but I think it's a really, really important intervention there. And I wonder what your plans are for this.
Oh, thanks so much, Alison. I did put a proposal into the conversation, but it was rejected. So if you or anyone else has any ideas of what might be a home for this, because I haven't submitted a paper yet or anything, I'd be delighted to take on board suggestions. Thank you.
Oh, that's a real shame, because I mean that element, just that element alone is so you said it. I mean, the ironies are just so powerful. I also wondered if I may just quick, I've got a really great PhD student, Tian Barrett, who's not joining us here at the moment, I don't think, but Tian spent, some great time remotely in the National Archives. And one of the things that about the border closures in the 1919 moment, one of the things that she uncovered, which came as a real surprise to me, was how what is, I think, a bit different to COVID is how then the authority to restrict movement was granted to, but also sometimes semi-illegitimately taken up by really, really local groups. So, town vigilance associations and town residential groups and the equivalent of Lions clubs and so forth. And that was one thing that really surprised me as quite different, that quite formally in some cases, authority that now stands with state governments, appropriately, in 1919 was devolved through various health acts, actually these really local, it's quite a scary thing to think about, a very, very local town groups were given powers to stop trains or to stop people moving over borders and so forth. And it seemed to me that the work that she's done, because like you, I agree that there's a repetition, in a way the fine distinctions become quite important. I do think that's one of them, that there's this devolution to very, very local authorities to do things like not vaccinate, but to restrict movement, certainly.
Oh, that's fascinating. I had seen proclamations locking down local areas, but I assumed that had been done by the state government, not by the area itself. So that's fascinating.
Great paper.
Thank you.
Thanks, Alison. Any other questions? Okay, well, we're out of time. Alison, just while I have your attention, thank you. And we're so looking forward to your Butland lecture this afternoon. So everyone, please don't miss Alison's lecture. If there are no further questions, I'll call time on the session. hopefully we'll be back this time next year with a further progress report on what we've done. So yeah, thank you to all the presenters and thank you to everyone for attending. So our next session is at 2 o'clock Eastern time. Okay. All right. So have a nice break. We'll see you again soon. Bye.
Well,